Everyone, my name is Tina Zook, and I'm the Government Relations Regional Lead for the American Heart Association covering New York. Feel free, though, to reach out to me anytime and ask any questions about the policy agenda we have for this session this year. First and foremost, our biggest priority this year is a new one for us. It's extending postpartum Medicaid coverage. It currently only allows for 60 days of coverage for pregnant people postpartum. We would like that extended to 12 months. We're very excited because Governor Hochul, as you probably heard in her State of the State address last week, also said this is a priority for her. We met with the governor's staff a few weeks ago and talked about this, and we reached out to the Medicaid director, who is also supportive. As you likely know, Senator Rivera has a bill. It's S1411, which would do just this, and Assemblyman Godfrey does as well. It's A307A. We had some good news just today in that the Senate Health Committee did pass out this legislation unanimously, so it now moves on to the Senate Finance Committee. Another one of our issues that is no surprise to you is trying to secure funding for SNAP incentives. We would like to get at least $2 million this year to help with this issue. As you probably know, food insecurity has always been an issue in many places, not just New York, but with the pandemic, it has really increased. In New York's case, for instance, there were 14.5% of folks who are food insecure, and with the pandemic, we've seen that increase by 35%. So this funding would go a long way to make sure that people are getting not only food, but healthy food. For every dollar they spend on fruit and vegetables, they get a matching dollar up to $20 in matching. So it's great news. It helps elderly kids and families, and it helps farmers and the economy. It's a win-win for everybody. So we'll be asking for your help there. And as always, tobacco program funding will be one of our priority issues. Currently, our funding is $39 million for the state's tobacco control program. We're asking the legislature to increase that to $52 million. We only get right now, or are spending rather, 20% of what the CDC recommends for an effective tobacco control program. Our ask would be a 25% increase, but we feel it's very necessary given the fact that 36% of kids use some form of tobacco, though we've made great strides in reducing smoking in New York State by kids. With the advent of e-cigarettes, the use of tobacco is very, very high. And for the first time ever, not only in New York, but across the nation, cigarette sales have increased for the first time in 20 years. So it is an issue that we need to address. And if we need a better reason than just the health of our citizens, the cost to the state in treating tobacco-caused diseases is substantially high. It's over $10 billion. It's $10.4 billion, and over $3 billion of that is Medicaid costs related to tobacco. So it's an issue of high importance. Another tobacco issue that we will be working on this session is eliminating the sale of menthol tobacco. We had some high hopes that New York City might do it first, but that didn't happen in the most recent council session. So we will be working again to both at the city level and statewide to see if we can eliminate the sale of menthol tobacco, which we know is a huge draw for kids because of the impact it has in suppressing coughs. Kind of a smoother smoke, so to speak, but it's also been aggressively marketed to people of color, and they are disproportionately suffering with high use rates and the diseases caused by tobacco. One of our other last priority issues related to tobacco is increasing the tobacco tax. Right now, we have a tobacco tax of $4.35. With a dollar increase, we could pull in another $30 million in revenue that could be used either for tobacco control or other public health efforts. And we also know that it has a substantial impact on reducing tobacco and preventing tobacco use. For instance, if we were able to get the dollar increase, it would prevent 29,500 people from smoking and get another 61,000 people to quit. So it really is a great idea. Those are our top priorities. We have some other issues that we're working on as well, but those are the highlights. And again, we thank you so much for all you do to help us in these efforts. And please do feel free to reach out to me at any time with questions on these issues or any other issues that you're interested in that impact heart and stroke health, heart health and preventing strokes, rather. My phone number, so you have it, is 802-578-3466, and you can also email me anytime. My email is just my name, tina.zuk@heart.org. Thank you so much, and have a great night.